In today's video, I want to go over the Medicare supplement plans versus the Medicare Advantage plans. If you don't know me, my name is Brian Monahan. I've been working with people going on to Medicare and people that are on Medicare for the past 15 years. And if you've seen some of my other videos, you know that I like to dive into the raw data so that I can show people what benefits the plans have and what costs for those benefits. So let's dive into the video. So in this video, obviously I have the Advantage plans up top, or what would be an average for an Advantage plan, and then an average High Deductible G plan. And the reason why I have these two up here is because, number one, the only plans that I show people for the Medigap plans, it doesn't matter what state you're in throughout the entire country. If I was to get a phone call from you, I would tell you about three plans: Plan G, Plan N, and Plan High Deductible G. I don't even discuss the other plans, possibly a Plan F if you're already on that plan. But other than that, I just talk about those three plans. And that's because they are the most cost-effective plans with the best benefits, in my opinion, of course. And other than that, with the Advantage plans, I like to tell people, especially if you're turning 65, and this is probably the most important thing that I'll say in this video. If you're turning 65, I would never get on a Medicare Advantage plan. And the reason being, if you want to do what is called a trial right, that is when you can leave an Advantage plan and go to a Medigap plan. You can, without health questions or underwriting, you can only do this during these two situations. The first situation is if you're on a Medicare Advantage plan, when you first get on for less than a year, and you say, I made a mistake, I want to go with a Medigap plan. You can go into that without health questions. The second time is if you get a Medigap plan, and you want to try the Medicare Advantage plan for less than 1 year, you can go back to the Medigap plan. So I would always say get on a Medigap plan first, and then if you want to try a Medicare Advantage plan, you can go over there, but go back to a Medigap plan if you want to. And this way you get to see both plans. And the way that some people can do this is going with the High Deductible G plan. The reason why I say this is the G plan might be $140 a month, compared to the High Deductible G is $40 a month on average. This is for a 65-year-old throughout the United States. And so $40 for this Gap plan compared to most of the Advantage plans for $0 is a real good comparison. Now, let me get into what these plans offer. So the Advantage plans, usually they're zero premium plans, but for the hospital coverage, they usually have an overnight stay of between $250 to $350 per day. Now, usually they're for the first 6 or 7 days. This is what you pay, and then it might be free. But even if it's for the first 4 days, you're going to pay $1,000 to be in the hospital. So this is one disadvantage of the Advantage plans that you have to be aware about. And I don't want to be hard on the Advantage plans for this video, but I want to show you how the High Deductible Plan G adds up, and why you should go with this plan as opposed to an Advantage plan when you first turn 65. So I really have to dive into the disadvantages of the Advantage plans. Next is the doctor visits. And with most Advantage plans, you might get a zero premium or zero copay when you go to your primary care physician. But if you go to a specialist or physical therapy or whatever it may be, it's going to be $35, maybe even $50 for some of these Advantage plans. So these are the questions that you have to ask the agent. Next will be like a PET scan or a CAT scan. Now, some of these plans, of course, I've seen where they're $50 and so forth. Maybe they're HMOs, because these plans are either HMO or PPOs. But some of the good ones I've seen that cover a lot, that cost $300 for a CAT scan or an MRI. So you have to be wondering about that. That's another question. Skilled nursing, they do get skilled nursing at certain facilities, of course. They have to be in the network, but they'll give 20 days at zero cost for a skilled nursing facility. And then the major thing that you have to look at is this maximum out-of-pocket, MOOP, or MOOP, some people call it. Now, I put down 7,550 because a lot of these plans, this is what the max out of pocket is. It might be 8,300 per year. Some of these plans, if they're an HMO especially, maybe they're lower. Maybe it's 1,900, maybe it's 3,000, but you have to be aware of what this maximum out of pocket is. And if the maximum out of pocket is really low, you have to ask yourself, how many doctors, how big is this network, how much is it to go in the hospital, these type of things. Now, these Advantage plans do come with a drug plan most of the time that will cost you $0 for the actual plan. You will have to pay co-pays with that, but the plan will be given to you attached to the Advantage plan for free. Same thing with dental, vision, and hearing. That will also be given to you with co-pays you'll have to pay, but it will be at a $0 cost to you. So you have your medical, hospital, drug plan, dental, vision, and hearing. Also maybe a gym membership and some maybe $60 a quarter. If you go to CVS or one of the pharmacies, you'll get toothpaste and so forth. So they give away a lot of these benefits. And a lot of these plans are at $0 cost. So why would somebody say, hey, this plan is $0, but I don't want it. I'm going to go with a Medigap plan. Well, let's talk about that. So, and I'm going to try to stop saying so in my videos because I actually got a comment where the guy was like, you say so all the time and it's annoying. So I'm going to try to stop that. So if this particular guy is watching, I am trying. Okay, the plan High Deductible G. How this compares with the Medicare Advantage plan, basically, you pay a $40 premium on average. It's a very low premium, $40, $50, $60 for this plan. This is a catastrophic plan in my opinion. And what this means is there's a $2,700 deductible for the year on this plan. This plan works like the G plan, except for there's this high deductible. Well, Medicare will cover 80% of this cost, and you will cover 20% of the cost up to this $2,700. So let's say you go to the doctor says, I'm charging $100. Medicare will pick up $80 of that. You will have to pick up $20, and you'll pick up all of this until $2,700. So what is the max out of pocket that you'll pay? Well, I have here $3,804. Now, the reason why I did that is because I took $40, your premium, times the multiplied it by 12, you get $480, and added it onto this $2,700. So this is the maximum. But let's say you never went to the hospital and so forth. Maybe you only spent $500 for the deductible. Well, now you're doing $480 plus $500, so it's much less of a maximum out of pocket. And the better thing is that you get 100 days of skilled nursing. You get your CAT scans and MRIs after this $2,700. They're all free. But once again, you'll pay 20% of that up to the $2,700. Doctor's visit, same thing. You're going to pay that high deductible, but you're going to pay 20% of those visits. Hospital, same thing. You're going to pay 20%. But why is this better? Because it doesn't cover a drug plan. You have to pay for that. Some of the drug plans are $5. They go up to, on average, $35 a month. So you have to pay for that. And dental, vision, and hearing, you will also have to pay that. And you will not get a gym membership most likely, and you will not get vitamins and all these different things. 2 reasons. I said this in the beginning of the video. That trial right is one of the most important things in Medicare. 9 out of 10, I want to say 99 out of 100 agents or companies that you call, if you say, what about the trial right? They won't even know what you're talking about. I have shown it in my other videos from the Medicare and You booklet. So it is in there. I think it's on page, from what I remember, 78. I'm not really sure. Just look in the book or the PDF and look up trial right. And what that means is what I said earlier. If you get on a Medicare Advantage plan, you only have 1 year. If you are sick or unhealthy and you say, I don't like this plan, I want to go to a gap plan. After 1 year, you're going to go into underwriting, which means they're going to ask you health questions. If you had a stroke, heart attack, if you have diabetes with a certain amount of blood medications, they don't have to accept you into these gap plans. Medicare Advantage, you're always accepted into. So it's easier to go from a gap plan to an Advantage plan. So when you turn 65 and you don't know a lot about Medicare, I always advise to try this plan first. And look, if you don't go to the doctor or hospital that much, it's only $40 a month, but the catastrophic benefit coverage is unmatchable. You can go to any doctor, any hospital that accepts Medicare in the country. You will never have to ask about networks. Let's say you live in New York or you live in California, want to go on vacation to Florida or Arizona or Texas, you can go. Any hospital or doctor that accepts Medicare will accept this plan. If you're on an Advantage plan, you have got to call ahead and see what hospital takes the plan. And you can't call up and say, hey, I have an Aetna Advantage plan. I have an AARP Advantage plan. Do you accept it? You have to know the exact plan and if that hospital takes that exact plan, because there's multiple Advantage plans from different companies. So companies might have 5 different Advantage plans within that company. Thanks for watching the video. I hope this helped you, and I'll see you at the next one.